Hello everybody and welcome to Fertility Journals. I did notice that I have a bunch of new subscribers, so if you're new, thank you for joining the family, and please don't forget to subscribe if you're watching and you are not yet subscribed. Just to let you know, I decided to start this YouTube channel as a way to share my infertility journey, to give back, because when I was going through my infertility, I relied so heavily on YouTube to be able to get information that motivated me through my experience and eventual success. As you guys know, I went through 12 IVF cycles, and my diagnosis in a nutshell was age-related infertility. So today, I'm actually going to share with you the different types of treatment when it comes to infertility. So if you are starting this journey or are just curious if you have exhausted all options, I know that this video is going to be really helpful for you. To get things started, I do have my notes here, so I make sure that I cover everything. What generally happens when you are going through infertility, your doctor initially will try to be able to give you a specific timeline. And this timeline is age related. So if you are under the age of 35, the doctor will recommend that you try naturally for at least a period of 1 year. If you are over the age of 35, they consider you advanced maternal age, and so they will recommend or ask you if you have started conceiving at least for 6 months, or set up a timeline for 6 months, which was the timeline that my husband and I used. Within that timeline, they will recommend a specific window that you should use in your attempts to achieve a pregnancy. And for us, we actually used the Billings method and then an online app called Globe to be able to really just track and make sure that we were doing the baby dancing at the appropriate time. If that does not work, then what will happen is your OB will recommend a series of testing. And the testing is just to ensure that all your ducks are in a row. They really just want to dot their I's and cross their T's to make sure that everything is okay within your body and functioning normally. Because you have been trying for a while now, and they just want to make sure that everything is going okay. So the tests are a lot. They are blood tests. They will also test for fibroids. They will see if you have a cyst or a history of those, to see the chances of the recurrent, I apologize in case that might affect your fertility. They will also do a test that is called the HSG, and that ensures that all the tubes inside that lead your partner or husband's little guys through are clear, nice and clear, to be able to ensure a pregnancy. And so they usually will recommend a series of those tests. They will also do a follicle count, just to see how many follicles you have. And this is actually a huge measure of fertility, because the number of follicles you have could actually end up really deciding what type of treatment might be appropriate for you. So these tests are actually important as you kind of undergo your fertility treatment. Then the third treatment that they may actually recommend is called the IUI. The intraurinary insemination process is a wonderful treatment, because for people who have no issues when it comes to the test that I talk about, the blood work is okay, they did the HSG and they're looks like everything is clear, then IUI really can be a great treatment option. And with IUI, what they do is that they introduce your husband or partner's little guys up, literally as near to the ovary and the eggs as much as possible. And so for this procedure, you would go to your doctor's office, and your husband or your partner will have to produce the sample, and then they will be able to actually clean out the sample to get the best guys as possible, and then they will go ahead and inject the sample. And so they usually recommend multiple cycles of this treatment, and for some people it is successful. If IUI is not successful for you after multiple attempts, then you may need to move forward to other treatment options. Now, when I started my journey, I did not know that in going through the more, for lack of a better word, invasive treatment of IVF, that there would be types that I could try. And so I'm happy to be able to share them with you to save you the trouble, because, whew, man, it was a lot to take in. But there are 4 types of the IVF treatment. Now, IVF treatment is in vitro fertilization. So what they do is that they actually inject the egg and with the husband's or partner's little guys in a petri dish in a lab, and you are then able to kind of monitor and see the progress of the egg to an embryo, which is implanted, which will result in a baby. And so if there is something going on in terms of your fertility, this is a very, very effective treatment. There are 4 types of IVF that you can select just based out of your diagnosis. Now, the first is the most invasive, and it is called conventional IVF. It is the type of IVF that you see all over YouTube. When people talk about IVF, most likely they talk about conventional IVF. Times are changing though now, and slowly people are becoming more educated about the other types of IVF. But this IVF is a wonderful gift. You can build your family off of it. The goal and intention is to recruit as many eggs as possible, and to be able to develop as many eggs as possible for retrieval, so that you can be able to build your family. And many people use it. In fact, it is great for individuals who have a lot of follicles, or who are able to mature a lot of follicles. And that follicle count that you do as a test with your doctor will allow you to see how many follicles you have. And that could be a good indicator as to what type of IVF treatment would be right for you. The second type of IVF treatment that is very important for you to know is called Mini Ivf. Mini IVF is designed for individuals who do not have a lot of follicles. It is even designed for individuals who do have a lot of follicles, but they really don't want a lot of embryos, or they don't want a lot of babies, or they don't want to go through the intrusive treatment. And so they also do Mini IVF. But for individuals who have minimal follicles, it doesn't matter how much medication you take, you're only going to grow so many follicles. And Mini IVF has a medical protocol as well that grows the eggs you have. It's designed to give every embryo a chance, and it is a type of fertility treatment that has been proven successful. Next is Ultra Mini IVF. So believe it or not, there is Mini, and then there's Ultra Mini IVF, where you're given even less medications in this process, and that is also used by individuals who maybe don't react very well to the medications, or have certain health conditions. Not everybody responds well to medications. And so this type of IVF is used for those individuals as well, because they may be going through medical processes that may not allow them to have a lot of these medications used for this type of treatment, and give them the promise of a baby as well. And then the last type of IVF as a treatment is called Natural Cycle IVF. And Natural Cycle IVF is the type of treatment whereby you have no medications at all. This is very useful for individuals whose fertility is probably very minimal, like maybe their tubes are just blocked, and everything else is fine. They just do a natural IVF cycle, retrieve that egg, and follow the natural cycle, and then it gets in vitro in the lab, and they put it back in. And I do know individuals who have had very successful natural IVF cycles. It could even be used by people who are just afraid of needles. You don't do very well with needles. Again, tied in with your diagnosis. I'll actually leave a video on one of my fellow patients at the clinic I use, Life IVF Center in Irvine, California. We both worked with Dr. Frank Helian, and Michelle is her name, and she did natural cycles. She was a huge motivation for me, because she's actually one of the reasons I was even more encouraged to go to this clinic. So I'm going to leave her YouTube channel so that you guys can kind of see how the natural cycle IVF works. And just as a caveat, when it comes to the different types of IVF, there are 4 doctors out there that perform all the, or are familiar rather, not perform all the IVF treatments, but are familiar with the other types of IVF that you can look into. There is my own doctor, the wonderful miracle doctor, Dr. Frank Yillian of the Life IVF Center. And there is, we have Dr. Zhang in New York City, and we have Dr. Sol Silber in Missouri, and we also have Dr. Jeffrey Keenan in Tennessee. He actually does the other types of IVF as well. And so hopefully you can be able to look him up, if anything, just to learn more and be able to educate yourself as you are exploring the IVF treatments, if you need to. Other types of treatment that you'll be curious to hear about, there are some individuals who actually go through miscarriage, unfortunately. For some of them, they go through successful treatment and they see that they miscarry, and the doctor might say that there is a high risk for miscarriage. Some are treatable. Natural killer cell clotting factors in the blood can deter a pregnancy, aneuploidy also. But in some cases it might be best, and the doctor will recommend you might need a surrogate. If you need a surrogate, there are two types of surrogacy. The one type of surrogacy is called gestational surrogacy as a treatment. This is when the doctor says there's nothing wrong with your eggs. There's probably nothing wrong with your partner or husband's little guys. They make embryos and everything is fine. It's just that you can't carry. And so if that's your condition, then you will need to get a gestational surrogate who will carry your baby for you. Now, the caveat in the fertility world, at least for me, is that if you can have your baby carried through surrogate, it's still your baby. The baby does a DNA test or ancestry test. You are still the genetic mother and father. And so in that regard, I think it's a wonderful treatment. It's just treating the fact that you can carry a pregnancy. Some people that did it, if you're curious, Gabrielle Union, Khloe Kardashian, Kim Kardashian, Sarah Jessica Parker of Sex and the City. They all did, gestational surrogacy. The other type of surrogacy is called traditional surrogacy, and this is when you use the surrogate's eggs to be able to create your baby. A lot of the traditional surrogacy is used by males, and for example, Andy Cohen, Anderson Cooper probably used traditional surrogacy to be able to have their children. And this is just, I'm hypothesizing. It would make sense that they would, as males trying to have children, but you never know. They could have used gestational surrogacy, meaning gotten an egg from a donor and their own sperm and created embryos and have them implanted. But just to give you an option as to the types of surrogacy that are out there. And so folks, those are the types of fertility treatments. I know I probably have missed some, so if you know of any that I missed, please go ahead and add them in the comments. Goal here is to create community so that people can have a one-stop shop just to get an understanding and an experience from somebody else as they go through their journey. Thank you for watching, guys. Until my next video. Bye.